Now, we are live. You missed the introduction. We have a whole giant fireworks introduction, song, dance routine. It was amazing, but you missed it. We are working with our backup producer, JT Street, today, sitting in for Sam Bailey. So I am happy that we are here at all. Welcome, Seven Investors, to the Wednesday edition of Seven Investing Now. My name, of course, is Daniel Brooks Kline. Maxx Chatsko, get off your Peloton treadmill. Be careful. Max, welcome to the program.
Thanks, Dan. I don't have a Peloton treadmill, but why don't you lead with that? Jeez.
So we start putting this show together almost the second the previous show ends. And of course, wherever you're watching this, we would like your questions and comments. Feel free to weigh in. About an hour before the show, I'm flipping around news channels and I see Peloton has recalled its treadmill. So if you remember, a few weeks ago, Peloton ran into some trouble. A child died on its treadmill. And Max, is it fair to say Peloton maybe underplayed the severity of what happened?
Yeah, I think they were a little too defensive too, when that came out.
Yeah, and here's the problem. Treadmills and little kids have not had a great track record. There is an absolute risk if you have a child under, say, the age of 10, it's probably younger than that, but let's say the age of 10, your treadmill should probably be in a locked place. You should probably take some safeguards. And Peloton more or less came out and said that, more or less said, hey, it's not our fault. We told kids to not use it. We told parents to be careful. And that did not go over well. When you have a division of the US government telling you to recall your treadmill and a kid died and you go, I'm not going to do that. So today they came out and not only did they recall all their treadmills, they actually aren't fixing it. They're offering you a full refund. So that isn't to say they're not going to come up with a fix, that they're not going to come up with some method to resell you a treadmill. And Max, the market has not liked this. Have you been following what's happened to Peloton stock today?
Yeah, it's down 15% or around in that range. So that's the lowest price since about August or September 2020.
So I don't want to call this an overreaction, but I looked up what percentage of Peloton's total sales were made up by the treadmill. Max, you want to take a guess at that number? It's in the document, but I'm going to assume you didn't read the document. Take a little guess.
I had no idea, but I saw it on Slack. It is abysmally low. It's 2%, right?
It is 2.2%. So they've sold about 1.6 million bikes. I'm going to guess that means they've sold, in the thousands of the treadmill. It's a very expensive treadmill. It's about $4,000, where a comparable treadmill might be like $1,500-$1,600. This is a pretty big difference, because you could argue that you could buy a pretty good exercise bike and put a Kindle Fire on it for like $400 or $500 and have a Peloton-like experience. But the comparable cheaper prices to the Peloton bike tend to be the $1,000, $1,200 range. That's not that big a divide. This is a massive divide. So I don't think the treadmill was a massive opportunity. I don't think Peloton thought the treadmill was a massive opportunity. I think this was a customer service issue where they were doing this because some of their customers wanted it, and there was going to be some ability to serve gyms and other places by having a full suite of products. I fully expect a Peloton rower, maybe some other Peloton machine. But Max, this is the market overreacting. We've seen this a lot. Do you remember what happened with Chipotle a few years ago?
Yeah, when they had all the norovirus, right, or E. coli, or both of those, really it took a few years for them to recover. But they also had wasn't their whole marketing pitch like food with integrity? So that didn't really do them any favors either. But
yeah, they were sort of hoisted by their own hubris. And with Peloton, when you're a luxury product and you take kind of an arrogant approach to life and death, that's not necessarily going to go over particularly well. I do expect this to maybe be a prolonged downturn, but I don't actually think it changes anything about Peloton's business. We will probably revisit this on future shows. We would appreciate your questions and comments. I see a great one there. We're going to take that one a little bit later in the show, because for our top story today, I called it a bit of biotech and a bit of retail. We're also going to talk a bit of T-Mobile, but I couldn't fit in what that was going to be. Max, we're in your space here. President Joe Biden, has said that he wants 70% of all Americans to have at least the first shot of one of the vaccines, or in the case of the Johnson & Johnson vaccine, that would be their only shot, 70% by July. Is that number attainable? We're at about 42% have had, I think, the full vaccine right now.
Yeah, so the amount of people who've had at least one shot is about 56% in terms of adults, right? important to point that out, be precise there. So, hitting 70% by July 1st isn't out of the question, but, you could doubt it, I guess, right? A lot of it now comes down to getting shots out to people who live more in the suburbs and rural areas, even more difficult to reach places. We really need to ramp up distribution of the Johnson & Johnson vaccine because, it can be stored at lower temperatures. You only need one dose. It's a lot easier to convince people to get one dose than 2 doses. So we really need that to ramp up if we can get that 70% goal.
So part of the problem now is vaccine hesitancy. Here in South Florida, you can essentially make a same-day appointment. There are places doing walk-ins. So maybe the CVS at a Target right near me, that's a very busy place with limited capacity to do shots because there's not a lot of waiting area in the pharmacy. Maybe you can't get an appointment there, but you could probably get one at the full CVS 2 miles down the road, literally on your phone while you're shopping, make an appointment. Maxx, do you think it's vaccine hesitancy? And do you think that Pfizer applying for a formal approval instead of just emergency approval, which they've hinted at doing, do you think that will change it for some people?
Vaccine hesitancy is an issue, and that's also the issue too. It's not just the Johnson & Johnson vaccine, right? If you look, just at demographics and those geographies, in suburban and rural communities, there is more vaccine hesitancy. So we might perfect the rollout of the Johnson & Johnson vaccine and ramp that up fine. And then nobody wants to get it, or too high of a number of people don't want to get it. So that is a real issue. And go ahead.
There's also a real problem of people getting their first shot and then just not going to their second shot appointment. That might get better as second shot appointments stop becoming a fixed thing. And it just becomes, hey, I've had my first shot. I'm more than 21 days out with Pfizer. I'm more than 28 days out with Moderna. I'm in CVS. I'm just going to get my second shot. There's obviously some concerns because of side effects. Oh my God, I don't want to take the second shot today because I have a work meeting tomorrow I don't want to miss. And that's become very tricky with people when I didn't have particularly bad side effects. My wife, about 24 hours later, was wiped out. Maxx, you had some not so great side effects, right?
Yeah, I got the Pfizer vaccine. And right after that, I slept for most of the day. But, I'm a scientist, so I knew okay, this is an immune response. So this is good. This means my immune system's working, right? That's what it's designed to do. So definitely, if you can get a vaccine, not trying to scare anybody.
Yeah. And I will say, I actually was a little nervous in that after my first shot, I had arm pain. And after my second shot, I really just had a little bit of the chills. And there was a part of me going, does this not work? And Maxx, I won't share who, but there's someone in my life that's under leukemia treatment. And the treatments he gets for leukemia, he had the vaccine, but what's knocking out his leukemia stopped the vaccine from creating antibodies. So he's going to have to wait until he's a few months shy of his treatment and then either take a third dose or take a different vaccine. So obviously people with special health situations, make sure you're consulting with your doctors. We're going to get back to Pfizer. We're going to talk about Pfizer's earnings because I was a little bit surprised. We're not going to do that next. And then after we finish the show today, we're going to play a video. I interviewed Anirban Mahante about Tesla earnings. We're a couple weeks out from Tesla earnings, but a lot of people asked us for this. We've been trying to fit it into a show. So we're going to close the show and then immediately start that video. We, of course, would love your questions and comments. It doesn't have to be about what we're talking about. We got sort of a hodgepodge of topics we're going to go through. Maxx, next we're going to talk about sort of the impact of where we work on retail and restaurants. We both work at home. But have your habits changed since the pandemic obviously you're not going to restaurants as much, you're not going to retail as much, but has anything massively changed? It has in my life, and I'll talk about that after you talk.
Yeah, I'm younger, right? So I definitely enjoyed going out more often. I think I've talked about before. I like to play darts, and I haven't been able to do that for over a year. So that's kind of frustrating, but I'm very much looking forward to getting back out there to do that.
So for me, besides that, we don't go out. We order in 2 or 3 nights a week rather than going out. It's not that I never go out, but it's a little bit no rules here in South Florida. So I pick and choose where I go out. I did go out, ate at the Cheesecake Factory of all places this weekend because they had outdoor seating and they had plexiglass and it felt safe in an environment where people aren't necessarily being safe. And everyone at our table was fully vaccinated, so I was probably being too cautious. But that being said, what to follow as investors for retail and restaurants. You are going to see a pretty seismic shift in locational flexibility. So what does that mean? Max, both of us used to work at a company that has a headquarters in Alexandria, Virginia. And I would stay at the Westin Hotel. And at that Westin, there is a bar restaurant, a lovely place called the Trademark, that had a great happy hour, great place to have a business lunch, easy walking distance, easy to stay. Up until very recently, for a lease reason, they had a Starbucks right there. There's one pretty close by. Now, with nobody coming into that office for the past 10 months or 12 months or whatever it is, and plans for less people to come into that office, I don't know the full plans, but I would assume all the office buildings around there are likely to have less people coming in. That is going to cause less sales for that restaurant, less sales for the nearby Starbucks, the Dunkin' Donuts, the Panera Bread. Some of those locations may not survive. Now, that's a heavily trafficked area. There's also plenty of tourists staying in that hotel, so it may not impact it. But you're going to see companies like Starbucks have 300 or 400 closures over the next couple of years. And that won't necessarily be because Starbucks isn't doing well. It might be because in New York City, that Starbucks was located at the base of an office building, and the company in that office building might decide, hey, we're not going to require people to come in 5 days a week, and the critical mass on that Starbucks might not be necessary. So as an investor, where would I be worried? I would be worried about smaller companies that only have a couple of hundred locations. This could be seismically bad for the company that owns IHOP and Applebee's because we're seeing breakfast and happy hour changes. So if you and I used to go, say, on Thursdays after work and go to a happy hour with our colleagues, and that's certainly something that happened with my former colleagues, that happy hour may not happen because maybe half of us aren't in the office. We might go meet at a bar in the suburbs where we all live. I get Starbucks coffee still, but not on the same schedule I used to. It kind of is like whenever in my day I feel like going to get a coffee, I go get it. And there might be a line at like 2 p.m. There might be a line in the morning. It could be really, really tricky. So I would just think of this as a watch and see trend, because we don't know if New York City is going to go to if most companies there are going to go to a 3-day work week where you have to come in the office, and maybe that doesn't change things that much. Maybe the lines will be shorter, but the sales will still be good because we're willing to spend more if we're not doing it 5 days a week. But you're absolutely going to see some businesses find that they're in the wrong location for where the population is. You're also going to see some businesses say, you know what? We now value outdoor space. Like there are 3 restaurant spaces near me that were built with outdoor patios, and it could be a coincidence that at least 2 of them have been leased during the pandemic and now have restaurants either in or going in. But I do think you're going to see changes in what retail looks like, changes in what restaurants look like. Now, is that going to be giant? No. And I'll give you another example. There was a Macy's walking distance to where I lived up until a few months ago. And it was a smaller Macy's, and it was kind of a slight profitable break-in proposition Macy's, because you weren't going to buy big things. It was more like, people in the neighborhood buying a t-shirt because, they needed one. And Macy's closed that store based on the demographics. It's a very wealthy area, but it just wasn't ever going to be a big store people made a lot of purchases in simply because they were walking there. So you're not going to buy big bags of stuff and then walk home. So you're going to see very smart businesses change their locations. That might not hit the McDonald's of the world, but you might see locations that were business driven, of a Dunkin' Donuts, of a Starbucks, of a whatever it is, that either switch to more delivery. So who's going to win? The bigger businesses that have done well during the pandemic, like a Starbucks, like a McDonald's, that have shown the ability to really embrace optionality, they are going to do really well. We totally appreciate all of you watching. SoFi Marketing shouts out to our own Sam Bailey, and JT, you can put that up if you want. Hey Sam, we miss you. Yeah, we miss Sam too, but we appreciate JT being behind the glass. Sam misses us as well. She has shared a comment too. We will see her on Friday. Great show as always. Not as always. We started a little rocky here. We missed you too. We will see you Friday. We will deal with some of your questions and comments later on. But Max, Pfizer had a great quarter. Why don't you give some of the numbers? And then I'm going to ask the question that I think all of the viewers would want to ask.
Yeah, so the company was expecting, I should start off with the coronavirus vaccine, right? So of course it's working with BioNTech, a German company. So we call it the Pfizer vaccine. Technically it's the BioNTech vaccine, right? Just to be precise. But they were expecting 2021 to have coronavirus vaccine sales of about $15 billion. Now they've raised that to $26 billion, Dan. So to put that into perspective, that would be the most revenue any single drug product has ever generated in a single year ever. So that is quite a haul for one product.
So I have an issue with this. When they first started talking about the vaccine, they talked about that they weren't going to make money on the vaccine, or at least they implied that. And they're actually running a 20% profit margin. I have no issue with that, but it does sort of seem like it was a bit of a bait and switch. Does that trouble you both as a scientist and sort of just as a human being?
Yeah, I mean, look, like the optics and the ethics of all this, right? It's a slippery slope. One thing to point out is the U.S. government agreed to pay a certain price per dose. It was $19.50 per dose of the Pfizer vaccine. That was a supply deal that the federal government, agreed to. So that's not really Pfizer's fault necessarily, right? I mean, the government could have been more like stricter in terms of getting a better price or something, but they were focused on getting over the pandemic. So maybe some of the nuance there. Additionally, Pfizer and BioNTech didn't actually partake in Operation Warp Speed. So taxpayers and the federal government didn't actually give Pfizer or BioNTech money for research and development to make this vaccine. The only deal they have with the government is for the supply of the vaccine. So that is a little bit different than, say, Moderna or Johnson & Johnson or some of these other vaccine developers. So again, maybe some of the nuance, I don't know if that changes it, but yeah, making a profit during a pandemic, it always doesn't, it's not a good feeling, right?
It feels a little unsightly. Now, that said, if they agreed to the price beforehand and then Pfizer figured out how to make it cheaper than they originally projected, I don't begrudge the profit. Again, $19.50 per shot seems relatively a low price to pay for something that's likely to prevent hundreds of thousands, if not millions of deaths globally. So again, I'm not ethically too concerned about it, but I actually would like to see Pfizer, like right now, come out and donate, like, I don't know, $500 million to getting vaccines to parts of the world that don't have it. And I'm not saying they're not doing that, but I'd like to see them publicly sort of support those efforts, because we are seeing massive gaps in where there are vaccines and who's ordered them and who's paying for them. We're starting to export AstraZeneca vaccine, which apparently isn't good enough for Americans, but we like it for the rest of the world. I'm teasing a little bit. It doesn't actually make sense for us to set up operations to administer a fourth vaccine when we have ample supply of 3 vaccines. So Pfizer is saying that you're likely to need a booster shot, a third shot. I'm one of the first people not in a trial to get vaccinated because I volunteered, and it was 70 plus when I got vaccinated. So it was really early in the game. Max, you don't actually think I'm going to need a third shot. Is that correct?
I think it's possible we will not need booster shots, or at least we won't need them every year. So there's this narrative that it's just going to be like the flu and we're going to need a shot every year and you have to get boosted up. And I don't think that's necessarily true, right? So there's a difference we talk about right now, right? Antibodies, right? I mean, you mentioned at the beginning of the show, I think it's all over the media. So I think a lot of the population knows about antibodies now, right? Because of the pandemic. So let's look at it this way. Let's say I get a shot, and then 12 months later, after my vaccination, I go and get a blood test, and they say, hey, Max, your antibody levels are 10% of what they were right after you got vaccinated. Does that mean I need a booster shot? Probably, maybe not, right? So the thing to know is that when we get vaccinated or you get infected, that triggers certain processes in your adaptive immune system. So the end result is that we generate antibodies. However, before antibodies, we actually generate T cells, and that's what retains your memory to the vaccine or the infection. After 12 months, your body might be like, hey, man, we made all these antibodies for this coronavirus thing, and we haven't seen it yet. Let's ramp down how much antibodies we're making. We still might have T cell memories in our bloodstream, and we do now have tests to detect some of these T cells. There's actually a company that's publicly traded. It's called Adaptive Biotechnologies. The ticker is ADPT. They developed a test called T-Detect with Microsoft, actually, and they can detect T cells in your bloodstream. It's way more accurate than just detecting antibodies. And I think we're going to probably be using this in the future as we start to answer these questions. We don't know how long antibodies to coronaviruses will last. Is it a year? Is it 5 years? Do we need a booster every 12 months or every 18 months or every 10 years? Maybe some people never need boosters. So I think it's going to vary quite a bit. So that's something that's why there's kind of more nuance involved, right?
I really hope that when you take your microscope and zoom in on a T cell, that it actually looks like the old marshmallow teas from Mr. T cereal. I'm guessing that is probably not the case. I'm only seeing myself on the screen. I don't know if that means we've lost Maxx Chatsko or we're just playing around in the director's room. Nope, we're just playing around in the director's room. It is a wild day today. If you want to put up the next to last comment, JT, thanking us for this month's recommendations, I'm going to say, so yes, we really appreciate it. I apologize. I can't see your name from where I am. I have sort of a weird mix of good vision and bad vision from my laser eye surgery. So I could see like an eagle while I'm driving, but not so well up close. But reason I bring this one up is we appreciate it. We're really excited about our recommendations this month. But Max, if somebody asks me, should I subscribe to a service that gives you stock recommendations in exchange for money, I would say, why, yes, you should, because us at 7 Investing do a great job. We're a very, very diverse, very incredibly experienced teams. And no matter what type of investor you are, you're going to get some benefit from our picks. But of course, if you're looking for an impartial source on whether you should pay for investing advice, I am not that. So why would I trust Pfizer, which has made billions of dollars, we've just learned, from the vaccine, when they say, hey, you're going to need a third vaccine? This would be like me in my family ladder and scaffolding days if I slapped a sticker on every aluminum ladder that says it's only good for 12 months, and then you have to throw it away and come buy a new one. What's the process for this? Does Pfizer make this decision, or is this some sort of outside body that makes this decision?
Right. So this is like vaccine manufacturer says we might need more vaccines. All right, so that does sound kind of funny, or like, why would you trust that? I think and Johnson & Johnson has actually said we might need boosters as well, Moderna as well. So here's a way to think about it, right? There's 2 reasons we might need boosters. First, you might need a booster of the same shot you've already received, so basically just a third dose. And that might be if there's waning immunity, right? For mRNA and even this new vaccine from Johnson & Johnson uses a different technology that's never been used before. We don't know how long and how durable our immune response is going to be. So maybe we do need boosters, or at least a third dose sometime in the future. The second reason we might need a booster is because there's mutations in the strains, and that's reducing the efficacy of the vaccines you've already received. So we might need a third dose of a slightly different vaccine. So all of these companies are actually preparing for this potential outcome. They're doing the work now. They're securing the manufacturing capacity. Just in case we do need boosters or slightly different vaccines, they're all working on that. I just think we should leave room for doubt that maybe we don't need it, or quite the volumes, or maybe we need it a little less frequently than the companies are thinking right now. But better to be prepared than to have to go into lockdowns again because we were caught off guard.
Give me all the boosters. I'll take all 3 vaccines. This starts this trip to Key West. I'm heading to Key West after the show today. Friday's show will be live from, I don't know, maybe a Starbucks parking lot in Key West, depending on the internet situation. But I will be speaking at Money Show in June live at the Omni Hotel in Orlando, Florida. I'm going to be on a cruise ship. We're going to do a show from there in July. I don't even know how that's going to work with the internet, but we're going to figure something out. I'm going to be on a different cruise ship in August where I have worked out where I'm going to do live shows from. So I want all the immunity. As many vaccines as you give me. I'll carry 6 of those cards around. I do not care. We have one more topic here at the top of the show. We're going to push your questions to after what we're watching. So I've got one more topic. I'm going to go very quickly on this one because it is a company people tend to overlook. Max, who is your cell phone carrier?
I use Google Fi like a true millennial.
Wow. I use T-Mobile. Why do I use T-Mobile? Because there's no nonsense from T-Mobile. If T-Mobile advertises it's $65 a line, that includes taxes, that includes upcharges, that includes, they don't even have overages anymore. So it used to be, nobody has overage charges, but everybody had this sort of rule that if you use too much data, they could slow you down. For its top tier program, T-Mobile has gotten rid of that. They relentlessly have done what they call their uncarrier moves. And that's basically what sucks about AT&T and Verizon that we could change. And they look at things and they every quarter pretty much come out with some little thing, and sometimes big things, that are like, all right, we're going to do this because it makes it better for our customers. A massive one was they got rid of contracts. Then they got rid of overages. Then they got rid of having to pay extra for all sorts of stuff. Like when I land in the Bahamas, I'll get a text from them saying, hey, 2G is free, texting is free. If you'd like 3G, it's $5, and you can get X amount of data, and you can pay it on your bill, and it's really simple. Whereas if you have AT&T, you might show up in a place where you're roaming and get out, come back for your trip, and have like a $600 charge. That happened to my mom on the first cruise we went on a few years ago. She got back and she didn't even know her phone was roaming. And had a massive bill for just things that happen in the background. What happens with T-Mobile? They add at least 1 million customers every quarter. So they added 1.4 million net additions. About half of those were phones. So many of those are iPads and other type devices. This is a company that, after their merger with Sprint, has gotten a lot more profitable. They have about $5 billion in free cash flow projected for the year. And their 5G network, the numbers are a little squishy because they have different names for it, but some form of 5G is covering 1.6 million square miles. That's 4 times the size of Verizon and 2 times bigger than AT&T. Now, is that real 5G? It isn't. It's just kind of better 4G, but they are putting the money in. They're ahead of the pace of their competitors. So do I own shares of T-Mobile? I don't. Why not? Because the investment is endless. Because the second they finish with 5G, they're going to have to start working on 6G, and then it'll be 7G, and then it'll be space holograms or whatever it is. So there is kind of a cash negative. But if you are looking to be in this space, this is the play. They don't have a lot of encumbrances. They're not sitting on, Verizon, which just had to sell, AOL and Yahoo for, some tiny percentage of what they paid for them. You don't have AT&T, which is saddled with its legacy media businesses that it does not do a great job of running. That it's saddled with DirecTV and other things that are really tricky. This is a pure play, more or less, in the space. They own some banking products and some other things that are convenient for their customers. But if you want a well-run company that makes moves, that has loyalty in a space where nobody has loyalty, I would go with T-Mobile. That being said, we're going to get to what we're watching in a second. We're going to talk RNAi and how it's setting a high bar for CRISPR gene editing. We're going to get there in a second. But before we do that, Max, it's Cinco de Mayo. That's 4 days after the first of the month. And I know for Cinco de Mayo, I think while you break out your Corona or whatever you break out, maybe you're gonna go for Mexican food tonight. I don't know what you're gonna do. You should also consider subscribing to 7 Investing. What do people get if they subscribe to 7 Investing?
So each month, on the first of the month, each lead advisor will make a recommendation. Simon asks us, what's our best pick? Why am I the only one on the screen? It's a little weird. I like talking to myself. There we go. Dan, you're back. Each lead advisor makes their recommendation. We write a research report. We do a team call with all the other lead advisors, and we get grilled. We get asked questions. We get critiqued on our pitch. So you get access to the report, the research report. You get access to the team calls. You get access to company updates on all of the recommendations we've ever made. You get all kinds of subscriber-only calls once a month. It's on the 3rd Friday of every month. We sit down, we talk to all of our customers, and we answer their questions directly. There's so much we do. It's hard to even name it all, Dan.
So let's pull up the comment from Jordan G from earlier today, because I think this is really relevant to why you should have been a subscriber. Have been a happy subscriber since launch, but interested to hear your take on the benefit to investors picking individual stocks versus just investing in index funds. If you look at the 7 Investing scorecard, overall, we outperform index stocks. And what happens when you buy an index stock is not only do you get the leaders, the ones that do well, you also get the ones that don't do well. So instead of, say, just buying a category leader, I'm going to buy retail leaders. I'm going to buy Amazon. I'm going to buy Walmart. I'm going to buy Target. Well, you might also own some JCPenney and some Dillard's. Now, obviously, there are better picked ETFs than others. And an ETF in a space you don't understand and don't have access to people making individual picks might be a good investment. But look at, say, the cannabis ETFs. There's 2 popular ones, and I'm not even going to name them because I don't invest in them. And the reality is their winners are saddled by their losers. And there's a lot of losers in that space. But if you were working with someone that truly understood that market, they might pick 3 winners and 2 losers, but they're not going to pick 2 winners and 12 losers. And that's what can happen in an ETF. And I know I'm oversimplifying it because absolutely, Max, I think I told you my new license plate is QQQ, and QQQ is a NASDAQ index fund. That is not something I picked. That is just something that showed up in the mail. And if you're a passive investor, you don't want to read an investing service. It's not the end of the world to just invest in the NASDAQ. That being said, If you look at our track record as a company, we aren't making short-term predictions, but in the long term, we will outplay those ETFs. Max is telling you, buy this, not that. And there's a reason for that. He has that expertise. The people picking ETFs are sometimes not subject matter expertise. They're often stock market, advisors. And I know that's not always true. There's subject matter expertise at certain places. But we don't recommend not doing your homework and going out there and picking individual stocks based on a gut. We recommend going to 7investing.com/subscribe and using our research to inform your stock picks. Now, if you're also researching and what we're doing is sort of nailing your conviction, that's awesome. But if you aren't doing the research and are just looking for ideas, you might look and say, okay, Dan's 47. He's a little more conservative. My pick this month was not conservative, but my picks are usually pretty conservative. I want to invest like Dan, but I'll throw 10% of my money into Max's stocks or Dana's stocks because I want a little bit more risk there. So if you want to join us, it is 7investing.com/subscribe, $17 a month or $170 a year. And Max, that's 2 months free. So that is the best bargain there is in investing. I won't even say any more there. So RNAi. First of all, Max, why is the I not capitalized when everything else is capitalized?
Yeah, so RNAi is RNA interference. So they just shorten it to RNAi. Now, in the last 3 weeks, there have been 3 different RNAi drugs or drug candidates that have shown the ability to reverse hallmarks of 3 different diseases. So it's been a really great month for the field of RNAi. RNAi is a form of gene silencing. JT, if you can throw up the first graphic. There we go. How does gene silencing work? So there's a couple different ways to do it. RNAi works by chopping up mRNA. So we silence gene expression that way by acting directly on RNA. CRISPR gene editing with knockouts silence genes expression by acting directly on DNA. So the outcome's the same. We reduce the production of disease-causing proteins. So that's what gene silencing is. That's the goal of gene silencing. If you can throw up the second graphic there, JT. Boom, there it is. So these, in the last 3 weeks, are the 3 different drug candidates, or even Oxlumo here just this week. It's actually on the market today. So 3 different rare diseases, and they've shown the ability to reverse different diseases. So this is one of the things that, CRISPR gene editing and some of those companies have come out and said, hey, we're going to go after these diseases and they don't have any treatments and it's so inconvenient. And, we can maybe possibly reverse diseases. And then here's RNAi in late stage trials or even on the market today doing exactly that. And oh, by the way, each of those is dosed once every 3 months. They're actually exploring dosing them once every 6 months. So meaning you would go into your doctor's office when you have to go in anyway and get a shot. It's not an intravenous infusion, which can take a few hours. This is a very convenient dosing regime. So it's safe, it's effective, it's convenient. It really kind of nukes some of the arguments for in vivo CRISPR gene editing that uses knockouts.
So Max, does this affect all CRISPR tools or just select ones?
Right. So that's a good point. RNAi is about gene silencing. That's pretty much all it can do. CRISPR gene editing is a little bit more diverse. So we can use it for knockouts, which is gene silencing. We can use it for inserting genes. So it's kind of like a second generation version of gene therapy. And then we can use it for maybe combinations of those two. So this would only affect, RNAi would only kind of steal the thunder from CRISPR gene editing that uses knockouts. But it does have implications. There's a couple of different companies that are publicly traded right now using in vivo CRISPR gene editing, possibly looking at knockouts. The leading one is Intellia Therapeutics. Its first 2 drug candidates, ones in clinical trials already, are using knockouts. So this has big implications for that pipeline and this approach overall for the whole industry, because there are safe and convenient and effective treatment options now for these rare diseases. So in the future, if the FDA is like, hey, we have some safety concerns here, or we want you as the CRISPR gene editing companies to monitor patients for several years before we even think about approving these things, it really does kind of limit the commercial potential for this approach when using CRISPR gene editing. So some of the safety concerns are, using knockouts. A lot of people in the media and investors and analysts, they talk about off-target effects, right? So that's like we're not directing the CRISPR payload to the right part of the genome. And that's actually not that big of a concern. The major concern for CRISPR gene editing, and this is true for any approach, knockouts or insertions, is the on-target effects. So that's actually just the way that CRISPR gene editing works. We cut both strands of DNA, And then we say, oh, the cells have natural DNA repair mechanisms. They'll repair it. And that's one of the most traumatic events in all of biology. So we're kind of taunting Mother Nature a little bit. And if we look at some of the studies that have come out in recent years, we've seen some kind of worrisome thing. There's large sections of genomes that just get deleted randomly, or random genetic material gets inserted. We've even seen chromosomal rearrangement. So that's basically like one of the major hallmarks of cancer cells. So it's one thing to have successful clinical trial results for CRISPR gene editing, even over the next 5 years. But what happens in the next 5 years if there's a very high rate of cancer incidence, higher than background, from those tools? I mean, this is one and done, and you can't reverse it. There's no undo button, right? We can't stop giving people CRISPR. So this could be a major concern for regulators. And now the existence of RNAi and some of these really, really great data results might really limit the potential for CRISPR gene editing.
So Max, are you saying I can't hit Command Z if my CRISPR doesn't go well?
Exactly.
So let's tie this up with a nice little bow here. Then we'll take a couple of questions and comments. What does this mean for investors? I mean, investors are crazy for CRISPR. I mean, basically you could have like a retail store and call it CRISPR, and it would probably do pretty well as a stock.
Yeah, I mean, some of the valuations here are crazy, and the Wall Street's not taking any of this into account yet. And this is still kind of like hot off the presses data. So I think the takeaway for investors is to focus on outcomes, not just technologies, right? You don't want to be a cheerleader for any specific technology. And for CRISPR, we really don't have any data in humans yet for the in vivo approaches. So there, at these valuations, there's a lot of risk that this stuff doesn't work out. So take a technology agnostic approach, focus on outcomes. At least when it comes to gene silencing, RNAi is crushing it right now. So that might limit gene editing knockout potential.
We're going to do our finisher in a second here, but we're going to take a few questions and comments. After we do the finisher, I'm going to say goodbye, close out the show, and then we're going to play a video a lot of you have been asking to see with our very own Anirban Mahante talking about Tesla earnings. It's really good. Anirban is unbelievably brilliant. So is everyone on our team, but he has a lot of experience doing on-camera stuff. So it is always a joy to get to tape something with him. And it's always like 5:30 in the morning. It's way before I'd be willing to tape. My friend Joey Kline, no relation, says that his license plate is actually a cannabis penny stock, and that was not intentional. Yeah, it's funny because my license plate, and my wife has actually said not to share a picture of it. I guess she doesn't want stalkers. But my license plate sits in a 7 Investing frame, and then it has the big QQQ in the middle. And I've noticed this must be something about the order they go in, because I've seen other new cars with the same thing. So I do think this is just bad luck, but it is kind of unfortunate because it does look like endorsing something. There was a question earlier on, JT, asking us from Deborah Harting. Yep, that one. Can we wait for some pullback and then enter? If we plan to add to some of the recommendations, I already own some of those stocks. So this is talking about our picks this month. So Max, you can give your opinion. I'll go first quickly. I don't wait for a price point. Now that said, if I was going to buy, say, Peloton, just to pick a stock we talked about earlier in the show, and I happen to notice that Peloton is down 15%, and I don't think the reason fundamentally changes my thesis, well, I might transfer some money in and buy it a week earlier than when my automatic transfer would happen in my investing account. So there's no reason not to capitalize on price dips, but I don't wait for them because there is no guarantee. We've all heard the stories of, I'll buy Amazon when it gets down to 1,000. And now it's trading, whatever it is, 3,200, and you never bought it. The best time to buy a stock is generally now. Max, how do you approach it?
Yeah, we get this every once in a while. I think there's some confusion, right? So the mechanics of just how we represent our scorecards, that we're thinking on the long term, right? So we announce our picks on the first of every month. And sure, in the short term, measured in months, there might be like a stock goes up, a stock goes down, and people will write in, should I buy this now? And that's missing the point, right? We do this because we know that 5 years from now, it doesn't matter if we release these picks on the 1st of the month or 3 weeks later on the 17th of the month. That's not going to matter at all in the long run. So what I do as an investor is, I kind of accumulate into positions over time. So I might say, oh, here's a stock I want to buy, and I'll buy some this month and some next month, and I'll do that for many months in a row. My largest holding I've actually bought for almost 18 months in a row now, right? So it doesn't matter what the stock price was. I know I'm buying every month. So you might want to do that. And then it doesn't matter. You're not so focused and obsessed with what is the price today? What is the price tomorrow? Over time, it's all going to average out.
So I do the same thing as what you do, Max. The only thing that bothers me is I use TD Ameritrade. I'm sure this is true on every platform, but when you add to a position, it changes your percent gain for that stock. So I might have a stock that my original position might be up 200%, and then I buy some new shares, and all of a sudden my overall position's only up 40% because I paid more for those new shares. I'd love to be able to click a button and see like how right I was or how wrong I was from those original dates. Now, as a 7 Investing subscriber, you can do that. We track our performance on our scorecard. Our scorecard can be daunting. We've been doing this, 7 picks a month for going on 14 months now. So there's a lot of picks there, but you can use that scorecard. You can say, I just want to see Dan's picks. I just want to see Max's picks. I can just want to see this time frame. We also every month give you our best buys. We give members a lot of tools to know sort of what they should be buying, how they should be getting in, and we are working on one where if they just want to put a few bucks into every stock, they'll be able to do that on sort of a really easy basis. So we can't announce that yet, but I'll tease it a little bit because it's something we're talking about. So if you'd like to join, that is 7investing.com/subscribe. Let's hit our finisher. JT Street, thank you for manning behind the glass. I know it is a scary thing, but if you want to pull up that graphic, if you don't have that graphic, there we go. So Max let me know that I framed this question terribly wrong, that my timetable was totally off. And it was actually, normally I would have asked Max beforehand, but he had let me know that he had some personal stuff to deal with yesterday, so I wasn't going to bother him. But let's not even talk about the answers so much. Max, what is the timetable you expect for cures? And I ask about this. I grew up with someone that has cystic fibrosis, and I would think she's at the age where that's not great. Obviously I'm 47 years old, so I'm not quite thinking Alzheimer's, but I hope they get to that in the next 20 years. And I feel like HIV/AIDS hasn't been cured, but it's already been managed. So Max, take that however you like. And JT, you're welcome to take the graphic down.
Yeah, I think with cures, it's like kind of a dirty word, right? Well, look, now I'm really small. This is awesome. So like even doctors and the scientists don't want to use the C word, right? Cure, because it's all about durable responses. So like with gene therapy, for instance, right? We can kind of cure diseases initially, but what does that mean 5 or 10 years from now? Do patients lose that benefit? So is it really a cure for the whole life, or is it not? And a lot of times, even though we just talked about this with RNAi, some of the damage that's been done by some of these diseases is difficult to reverse. So we might actually relieve all their symptoms going forward, but there's still been damage to organs or other systems in the body. So is that really a cure? Like they're not really returning to necessarily like normal function. So the C word is always kind of a dirty word. Now, in terms of like, go ahead. Do you have anything?
I was going to say, in terms of like cystic fibrosis, cancer, Alzheimer's, HIV/AIDS not being a death sentence, or even being something manageable or that we could stave off for 20 or 30 years. Is that conceivable? And what would the timetable be?
Yeah, so we are seeing more complete responses for cancers, like with different tools and new tools, we're getting more precise. So that means more patients can put their cancers into remission. And again, we use remission instead of cure for cancer, right? Because it can come back, maybe it doesn't, maybe it does. But we are getting better there. And actually, I looked into this after I kind of chastise you in our personal Slack. But for cystic fibrosis, like we actually have some pretty good treatments. There's triple combinations now from Vertex Pharmaceuticals, and we might actually be able to cure that or have some pretty durable treatments here, maybe even in the next 10 years. HIV/AIDS, we've actually seen some patients actually have cures as far as we can detect. It seems to be the result of getting a bone marrow transplant, not related to their HIV or AIDS, but due to maybe they have a blood cancer. And then later on, we observe that they don't actually have HIV or AIDS anymore. I'm not sure if that's workable for most patients, but potentially hints at some things we can do or develop down the road. But yeah, I'm incredibly optimistic, Dan. I just think we have to be careful and limit our expectations, right?
Doing this show has made me incredibly optimistic. It's also made me more careful. So, I've talked a lot about exercising, and, I see a trainer 3 times a week. I make sure at least 3 other days a week, I close all the bands on my watch. That usually means taking a 2-mile walk or hitting the treadmill for half an hour. I've done things like I'm trying to only eat red meat once a week, eat more fish, make the changes that are easier to. Max doesn't like fish, is he?
No, red meat. Eat all the red meat you want. What are you doing?
I'm a little bit older than you. I'm trying to be a little bit more heart conscious, a little bit bit conscious of things you can control, that look, it's not that hard to go take a half-hour walk. And I live someplace that, I mean, right now it's really hot, so I'm more likely to go to the treadmill. But I live someplace where I have a lake, I can walk around, there's bunnies. It's very nice to take a walk when it's not 110 degrees out. So we highly recommend you do that, because we want you sticking around to watch 7 Investing Now. We'll be back on Friday, live from somewhere in Key West. Internet service not great in Key West, so it literally could be a Starbucks parking lot or outside at a Starbucks. But if you'd like to get in touch with us, and remember, we're going to play an interview after this with Anirban about Tesla earnings. But if you'd like to get in touch with us, you can email us at info@7investing.com. That's questions about your membership, questions about our schedule, questions about maybe you're thinking about being a member. Generally, don't ask us to sort of, our opinion on a specific stock. Ask those on this show. And if it's one we want to talk about, we're happy to take it. Ask us on Twitter. If it's a company we're comfortable. If you are a member, please don't share any of the pics on social media. We appreciate you not doing that. And on Twitter, we are at 7Investing. That's where we put the polls up for this show. That's where we reshare discount codes sometimes. If you're not a member and would like to join, we might share that out. And of course, hit us at 7investing.com/subscribe. What are you waiting for? Why are you watching this entire show and you are not a member? We appreciate you doing that, but we really think you should join. And with that, Max, thank you for this. We're not going to do our usual post-show wrap-up, but JT Street, thank you. And if you want to hit that video, Anirban Mahante on Tesla. That did not appear to work. We're going to stick around for a few seconds, and here we go. Mahante, welcome back to 7 Investing Now. So Steve Symington and I talked about Tesla, and you would be shocked by how many people in the comments asked why you weren't on the show, though most of them accepted the answer that it was something like 2 in the morning. Most people were okay with that one.
I was very keen to get up, but getting up at 2 o'clock basically means the remainder of the day is going to be ruined. But I figured I will write an article, which is what I did. So and it's a free article, so anybody can access it. Actually, it's not a subscription article. So
this is one of those things where we're taping this at 7:30 at night. I turn into a pumpkin after 6 o'clock. I am not a big fan because I start my day pretty early. I work straight through the day. By this time of night, getting my energy up to host a show is really, really difficult. I don't think I would have done well in overnight radio. But let's talk. You called it. You named it nerdy points about Tesla's earnings. Let's get to the nitty gritty here because I talked about this with Steve. Is Tesla making money? It's not as obvious as it would seem.
Yeah, so Tesla is making a lot of money, right? So approximately, if you think about it, it made about $4 billion of free cash flow trailing 12 months, right? $4 billion of free cash flow. That's a lot of money for relatively early stage business. If you think about it, right? They're probably at a run rate of 720,000 vehicles. If you take the Q4 production, multiply that by 4. So for a relatively niche vehicle manufacturer, they're making a lot of cash flow or free cash flow. In terms of then people like to say, well, okay, they made that much money, but there's always a but, right? And the but really is that there's a lot of regulatory credits in the mix there. But the way I think about it is that if you are in a lucky position to have regulatory credits, which is 100% margin, you would use that to grow your market share by cutting costs, to keep competitors at bay, right? That's what people with scale like Walmart and Amazon do all the time. That's what you should be doing, and I think that's what they're doing. So I think that's fine. Yeah,
I'm actually more concerned about the $101 million they sold in Bitcoin, and it's not the money they sold. And I know this is kind of a trivial number for where Tesla is. But they're still sitting on $2.5 billion in Bitcoin. And if you told me a year from now that's worth $7.5 billion, I'd believe you. If you told me it was worth $100, I'd believe you as well. So I feel like I get the troll game Elon Musk is trying to play there, but that does seem to me a bit like he's got some of the company's money on, half the numbers on the roulette table.
Yeah, so I'm not that concerned as I think it is a gamble. That's exactly as you're saying. It looks like a gamble. I think he believes, and Kirk, Zach, the CFO, I think they believe that it's going to go up, or at least it's a better store of value than cash. They're going to get better returns than they would get on cash by investing the cash in cash-like instruments. The $100 million of sale that they made, I mean, I think they just did that to A, test, what they can get out of it, and B, I think here's another way to think about it. They have this Bitcoin investment, which they could use anytime to juice their numbers the way they like it. Now, you could say that Tesla is turning into an investment company, but that's if you can trade your way on Bitcoin and make some money, and if that is Tesla doing that, as a shareholder, I have no issues with that. Be my guest.
As a Tesla owl, that is someone who's watching, but is neither bearish nor bullish. I'm trying to get this one to catch on. The financial shenanigans to me I don't love it. If it was a CEO who you knew was always above the board and he was using every tool available, but all the SEC goading, and I don't know, it just feels to me like there is some risk there. But let's talk about margins. In theory, cars should be a pretty good margin. How is Tesla coming in on them?
Yeah, cars are not that great a margin. I mean, luxury cars are, right? I mean, so Tesla's margins are improving substantially. So there was, I think, about 130 basis points or 1.3 percentage point increase between Q4 and the Q1 just report. And I think the key to note here is that the margin improved while S and X, which is their higher margin product sales, disappeared, right? And that disappeared because they're upgrading that line for the Plaid and the new Plaid series, which apparently has strong demand. But at the same time, they also took about a $200 million cost, which showed up in the COGS line for the retooling. So if you put all of that together, margins have improved while their cost base went up, which I think is one time. Many of these things are one time. At the same time, they had no sales of their higher margin vehicles. So I think the margins are actually trending in the right direction as far as I'm concerned. And I think this is just a little bit of the scale game coming into play, combined with the fact that I think the Fremont factory is not ideal because it's a Toyota GM factory that has been repurposed, whereas I think this Shanghai factory is giving them good margin as it is as scaling up. And I think the same thing you would see probably play out with, maybe at the Texas Austin one and the one at Berlin. So I think that's traveling in the right direction.
At least they're not still building intense in a parking lot. I have a lot of questions I want to ask you about this. I'm just going to keep it to one. Do you think selling AutoDrive as software as a service instead of as an upfront cost is going to drive their margins higher going forward?
I think so. So the full self-driving suite is a $10,000 in Australia, for example. It's $10,000 upfront. Not everyone is going to be paying $10,000. It also has weird ways in which it, for example, in Australia, it impacts how much luxury car tax you pay. Now, Tesla is a luxury car here, and you pay actually luxury car tax on it, which is unlike maybe in America. So I think $10,000 you tack up on a $35,000 car, or 7,000, 8,000, whatever it is in America. It's a pretty substantial amount. So I think providing it as a subscription makes a difference. And in my view, it doesn't even have to be what has been promised as full self-driving. It just has to be an advanced driver assistance system, and people will fork up $100 like they fork up for, music subscription, right? So
I will point out that my entire car, admittedly, my 2014 Toyota Prius cost $10,000. So, and it doesn't have all the bells and whistles. It doesn't drive itself, but it's a nice looking car that gets really great mileage. I'd have a hard time spending an extra 10 grand. I'd probably spend $100 a month. I think that is a more palatable to deal with it. Last topic.
I was just quickly add, right? So my car was in the body shop, and I had a different car to drive, and like getting my Tesla back was like a relief because, I am so dependent. Actually, I should maybe be saying this on air because, my license might be taken away. I feel so dependent on the autopilot because, it does a lot of the driving for me, and it just makes me a more relaxed driver. So I think, if that option was available, I would also take the subscription option. Although I think in the long run, it costs you more.
I would love that. I do not enjoy driving. If I could sit with my laptop and get work done while I'm driving between West Palm Beach and in Orlando, that would be a major victory. And that's pretty much a straight road. When you talk auto driving, like the Florida Turnpike, which connects those two places, is a relatively low traffic. It's the kind of place where auto driving is going to work first. And we've talked about this. The first place it's going to happen is like closed communities like Disney World and college campuses and places that could be the Microsoft campus, places that could be really, really controlled. I only mentioned Microsoft because they have a shuttle network because they're so spread out between Redmond and Bellevue. But we're going to talk about this quickly because we're kind of running out of time. What about the energy segment? It's not a meaningful business at the moment right now, right?
Yeah, so the energy segment is roughly about, it hovers around 10 to 20% of the auto revenues that's being generated. I think the problem with the energy business is as follows. I think the solar side is losing money. That's, again, based on my assessment from the call. The power, the mega pack, which Tesla actually sells to utilities, which is actually supremely important for the stability of the grid. I think it's actually losing money on that because it doesn't have scale yet. It has gross margin similar to auto for Powerwall, which again is backlogged so I think a couple of things are happening here. I am not so sure of what's happening with the solar and solar tiles business. I think that's a little bit of a question mark in my mind. I think the battery pack business is actually a great business, and there's a lot of ancillary revenue there, that they can make from, the auto bidder, for example, where they bid and make money on the grid for just supplying instantaneous demand. So I think that can scale. And then the main key thing here is just the battery supply, where I think they're working on this 4680, whatever they call it, the new battery pack. So the vertical integration scale, more batteries coming online from LG and Panasonic, all of that should help. Solar, I'm not sure. That's a question mark in my mind.
I'm looking forward to their next battery day where they announce plans for 2045 that have zero possibility of happening. It's always an interesting company. I'm going to throw out one last question. I assume living in Australia, you still are familiar with Saturday Night Live. Like it's been an institution. It's been around for 40 years. Elon Musk is hosting. I think this is a terrible idea because this is an actual live television show, and Elon Musk is unpredictable. He could come out and say that vaccines, cause your face to fall off. Who knows what he could say? As a Tesla shareholder, are you excited about this? Are you nervous about it?
Well, I think this is going to be the best Saturday Night Live show with the highest TRP ratings, television ratings that you can expect. I am not that worried about Elon Musk. I take the good and the bad of Elon Musk. So, I think he's the greatest entrepreneur, not of just generation, probably of the past 30, 40, 50 years, right? With that comes a lot of quirks. There would be no one else who would be sending people to Moon, Mars, space station, other than Elon Musk. He's basically not like the NASA now. You get the good and the bad. I think he's a very long-term thinker, which I like as a shareholder. And I think all the other pesky little things, I don't really worry too much about them. You're getting in a fight with, he's a rule breaker, so he breaks rules. But I think I look at it like, he's doing things with the right intent. He wants to build this company, which is going to actually fundamentally change how we do transport, energy, sustainability. I think it's a big goal. There's going to be a lot of roadblocks on his way. So, he doesn't like those roadblocks, which, so I'm okay with it. I don't know what he's going to say, but yeah, I think it's going to have very high ratings. So we'll see.
Anirban, we are not very good at being quick or concise. We were supposed to do 5 minutes. I think we're roughly at 14 minutes. So I'm going to say thank you for this, and we will see you next week again on the program.